as Lauren said, my name is Eimear, or some of you probably know me. And what I'm going to be talking today is basically about breath and exercise. So I'm going to start off first talking about exercise, but more in particular, physical activity. So not just formal exercise. So just explain a bit about it, why it's so important for all of us, and particularly, well, not particularly, but also then when we have like maybe a lung condition as well. And then I will go and speak a little bit about breathing. And the reason we're talking about breathing together, or the way I want to talk about it, is because our breathing can be challenged a bit whenever we do movement and exercise, and then more so when you have maybe lung fibrosis. So with this, then I want to explain just a little bit more about how we breathe, and hopefully that knowledge can kind of give you a little bit more kind of power, because they say knowledge does give you power. So that hopefully I would feel is one of the best tools to understand. And then just also a few simple techniques that also you could possibly use. Okay, so, and then, yeah, just questions at the end. So the topics I kind of probably did say, but what we'll talk about first is what exercise is. And then also, but kind of more also just about physical activity. So there's different definitions. So just to kind of be clear that it's not just formal exercise that I'm referring to, even when I use that word. Then exercise or physical activity as part of your wellness. And then I'm going to talk about the benefits more in detail. So just kind of more specific. Then in relation then also then to lung fibrosis, the benefits also. Then just mention briefly just some of the scientific evidence for exercise in relation to lung fibrosis. Then a little bit about how we can get this exercise or physical activity into our life, and also just a guide maybe about how much. Then I'll go on and talk a little bit about breathing and how we breathe, just to give some more information. And then about the techniques, or some simple techniques, breathing techniques you could use. Okay. So here, this slide then is about what I call exercise or physical activity as a key component to our overall well-being. So the reason I wanted to put this in and just mention it is that often when you talk about exercise, and physios do, not all of them, but they'll kind of make it sound like, well, maybe not very enjoyable, and it's something that you have to do, and maybe quite specific to your physical body. Whereas I think it's good to understand and really appreciate that exercise is something that hopefully should be part of our life always, whether we're sick or not sick. And what I mean again by it's exercise, but really just physical activity. So what I would say it's one of the key to our wellness. So that would include then like good food, hydration, good sleep, safe, comfortable environment, or like a home, healthy and caring relationships, sense of well-being, and then have at the end then, yeah, physical activity. So that's kind of what I'll be talking about today. But we will go a bit more specific, but this is just where I suppose I will be quite passionate about it being part of really just something like our life, and it's something that should always be part of our life. So another way, like I like to explain it sometimes, is that it helps to maintain a balance between the different aspects of us at any given time. So if we just pick I'm kind of keeping it kind of simple, but the physical body, and then our mind, our mental body, so that would be our thoughts and emotions, and then our sense of self. So exercise or physical activity can help our physical body be as good as it can be at any given time, but it'll also then interact and help our mind, our mental body, and our sense of self. And then when either one of these is improved or a bit better, it'll help the other. So it's this kind of knock-on effect. So yeah, as I said at the start, often people kind of, when they're been recommended by maybe a healthcare professional that they should do more activity, they'll use the word exercise, which is fine. But I just want to kind of, I suppose, bring in and be clear that in relation to all of us, or me, myself, I like to just be quite physically active. So that can be formal exercise. So that would be like the ILFA class that we do, or going to other class that I would do, but also even just going, like doing gardening, kind of just being generally active, like some housework can also make you be quite active. So the definitions they give is lifestyle physical activity is the daily accumulation of at least 30 minutes of activity. So it includes all planned, unplanned leisure, occupational or household activities that are at least moderate in intensity. So I suppose they do kind of maybe define it a little bit that you do ideally for it to be termed physical activity, that it should be maybe for greater than, they're saying 30 minutes, but maybe at least more than 10 minutes at a time, just to kind of give your heart and lungs an opportunity to start to work. Then exercise, and the next one you see is a form of leisure time physical activity that is usually performed repeatedly over an extended period of time with specific external objectives. So example, improvement of fitness, physical performance, or general health. So that will be like the ILFA class. Then the last definition that's used kind of often, particularly in literature, is physical activity. So this includes actually both. So this is probably maybe the word then I would maybe prefer. So it compromises any bodily movement produced by your skeletal muscles. So it's all our muscles. That results in a substantial increase in energy expenditure over resting level. So from that, then really anything goes. So you just really are wanting to use your body. So the muscles in your body, so that your heart and lungs have to work a little bit more. Okay. So then we'll just look, or I'll talk a little bit then just about the benefits kind of more in detail. So I kind of explained about how exercise just is part of our overall wellness, but I'll just go into just a little bit more specific. A lot of these to do with the physical body, but a few also to do with our mental health. So the first one then, fitness. So this relates to kind of the functioning of your heart and your lungs. So being basically kind of more efficient, kind of strengthening the heart muscles and your respiratory capacity as well. So your breathing. So where you'll be able to do things for longer. Then your muscle strength. So your muscle strength can also be improved or maintained by being physically active. Your flexibility. So your overall flexibility. Your coordination. So again, it does depend on what kind of movements you're doing, but definitely if you're challenging yourself with different kind of movements, this can help your coordination. Then your balance and your balance reactions. So again, physical activity can help this. Now it does depend, I suppose, probably on what kind of physical activity you're doing, but with some exercises you can target your balance more specifically. Then increasing in your energy levels. So yeah, obviously if you use energy and kind of you maintain your fitness or increase it, you're more than likely going to have more energy. Then help maintain healthy blood sugar levels. Your heart health. So that kind of relates to the first one, reducing BP. Then your bone health as well. So there's a lot of evidence now to say that physical activity and different types of activity and even kind of weight kind of training, kind of lifting different types of weights is good for our bone health. So the bone density. And then helping maintain a healthy weight. Then reducing systemic inflammation. So this is like, well, all of them are really important and they tend to interplay with each other. But the systemic inflammation is very important because the next one is these different conditions, so cancer, heart disease, diabetes, dementia, and mood disorders appear to be now, there's a lot of evidence to suggest that systemic inflammation can be a huge factor in the triggering of these different conditions. So if you can reduce your inflammatory kind of markers within your body, it's a great thing. Okay, so then improve cognitive functions. This is our thinking. So also there is evidence now kind of to suggest in relation to people who already have like maybe dementia, early onset dementia, or people also, there's even studies to show that it could prevent the onset of dementia as well. Then improve breathing pattern, improve your sense of well-being, help increase body awareness. So that's just your awareness of your physical body. And yes, but a little bit hard to describe sometimes, but when you're moving one part of your body, like your arm, that your trunk isn't moving. So you're just more aware of how your body moves. And this can be very beneficial in relation to kind of preventing injuries, but also, just for your overall well-being. And then decrease stress levels and improving sleep. So this slide then what I have here is exercise as a drug. So some of you may have heard this term or where it's been said. So yeah, it's becoming kind of more popular to kind of describe exercise or physical activity this way. So it's like this wonder drug that gives all those benefits that I'm talking about. And that it's just part of our life and it, like for overall well-being and wellness. And I suppose the wonderful thing is that it in general doesn't give you any side effects. Now, obviously, if you do it to an extreme level or do it maybe at a time when you shouldn't, but in general, you're not getting any side effects. So even if you're doing it for something specific like weight loss or balance, you'll hopefully even get other benefits. So it's, yeah, so from that point of view, it really is a wonderful thing. So yeah, I just have that it's holistic. So again, that gives you it has the overall benefits. So it's not just the physical body. It'll hopefully help your mental health and your sense of self. Safe then in general, as long as you're mindful, and then can titrate easily. So that just means that you can normally easily increase it or decrease it as you need. Whereas with a drug, well, they can be titrated, they can be increased and decreased, but normally not on a given day. Normally, with most drugs, you take your set prescription for a month or whatever, and then it can be reviewed. So yeah, exercise. Obviously, I'm a big fan. Okay. So it can also then be used to target specific symptoms. So even if you're, as I say, it should be part, not should be, or I feel it's important to be part of our life always. But sometimes we may want to be a bit more specific about the exercise or physical activity that we do to target something in particular. So normally in kind of the medical world, when we're using it for this reason, we normally use the term more rehabilitation. So, for example, pulmonary rehabilitation. So, where you're doing a physical activity, exercise, but with kind of quite a specific objective, or like post like a knee replacement, cardiac surgery, improved balance, or after like neurological condition like stroke or Parkinson's diagnosis. Okay, so then physical activity and lung fibrosis. So all the benefits I have talked about apply. So ideally and hopefully you'll get improvements in many aspects of your physical body. So the different things I talked about. So hopefully your functioning of your heart, and then also we'll talk a bit about the lungs, reducing maybe systemic inflammation, your bone health, your balance, coordination, healthy weight, then also mental health. So hopefully improving just your kind of, yeah, just how you see yourself and different things like that as well. So yeah, that's what I've put in here. So just to remember a key to wellness, so that it will be part of then helping the physical body, the mind, and then the sense of self. And then normally with improvements in either of those, so for example, in your mind and your mental health, that will in turn help your physical body. So they all kind of help each other. However, as I mentioned, you can also use exercise to target specific symptoms and conditions. So I'll just go again a bit more specific again. So how exercise can help. I've kind of already said it, but your cardiovascular function, so strengthen your heart. So where hopefully your heart will be kind of basically just fitter, so that it can work a bit more efficiently for you. Maintain and increase breathing muscle strength, endurance, so that's kind of the ability for them to work longer, and then flexibility. Also, it can help chest wall flexibility. So this is true, perhaps kind of improve breathing patterns and kind of taking at times a deeper breath. So this can help then flexibility of your actual chest wall. Increasing energy, with then in turn reducing fatigue, reducing fear and anxiety related especially to breathing. So this can be can be wonderful, when it happens. So so often what is reported sometimes with in lung fibrosis or other conditions where your breathing is specifically affected, that people sometimes will start to avoid physical activity, exercise, because of a fear of becoming breathless. And then they, unfortunately, then will become a little bit weaker because they're not really exercising as much as they could. So the benefit of though exercising and doing it in a safe way is that you'll hopefully become more confident about what you can do. So yeah, improving your breathing pattern as well, and then improving your sense of well-being. So this is just, I'll briefly just go through then the scientific evidence for exercise and lung fibrosis. So there's not as much in general scientific evidence for exercise or physical activity with lung fibrosis as opposed to COPD. But there is growing evidence now, or there's more studies that are being done. So there's a Cochrane review, which was in 2021. And it obviously was very positive about pulmonary rehabilitation, having positive effects on your exercise capacity. And then the NICE guidance, they also are positive and recommend that pulmonary rehabilitation should be offered to people with lung fibrosis. And then also the American Thoracic Society and the European Respiratory Society also have positive guidance for exercise and pulmonary rehabilitation. And then the same for the British Thoracic Society, Australian and New Zealand guidelines on pulmonary rehabilitation. Okay, so then what I'm talking about today, even though like in the topic, the word is exercise, it's really exercise, including physical activity. So any form of activity. So you see the second part then includes, so where I suppose ideally what they say is if you could have a combination of aerobic, so that's where you're using the heart and lungs, but maybe at times also some resistance. So that's where like you're lifting weights or pulling something. So that could be gardening as well. It doesn't have to be like weight training. So, and then flexibility as well. So if you can get a little bit of flexibility in, and then breathing exercises can also be included. Okay. So it can be structured or unstructured, your exercise or physical activity. So in that it could be a weekly class that you go to. So for example, like the class with ILFA, or a pulmonary rehabilitation program, walking, cycling, dancing, yoga, golf, like any sports, weight training, swimming, Tai Chi. It could be a home exercise program that you've been given, or like exercise programs that are on YouTube as well. So like there's really many ways to get your physical activity in, but it's important to remember that it's also your daily activities. So things that you do, so which could be your housework, gardening, farming, fishing, like different activities that you do. So if you're physically active and you're using different muscles and your heart and your breathing have to come up a bit, then you're physically active. But I suppose the thing will be if it can be nice if you can do it for a period of time. So maybe 15, 20 minutes, which was there at the start, I think was one of the first slides. Okay, so then how much? The guidance on that, so kind of how much would be, or kind of the intensity would be moderate intensity with lung fibrosis. So on the Borg scale of rate of perceived exertion, that would be 3, 4, 5. Or simply then kind of described, it will be where you can speak. So if you were doing your movement or physical activity, that you could speak if someone asked you something. So that means that you're kind of working at a moderate level. But your breathing has come up though a little bit. You are challenging yourself. So then 150 minutes of this intensity, moderate intensity exercise per week, including some muscle strengthening ideally, is what the CDC have for their guidance. Then the WHO is similar. They say 150 to 300 minutes of moderate intensity. Then as for any medical condition, or at any given time, this may or may not be possible, but this just gives us a guide as to what I suppose the medical community would be recommending. So if I just put in here as well, but get guidance from medical team if you're restarting exercise or worried about a new or worsening symptom. Okay, so these are obviously just guides, but always kind of seek out help if you're a little bit worried. Okay, so now we're going to talk about breathing in relation to kind of exercise and then particularly to do with lung fibrosis. Okay, so with exercise or physical activity, your work or breathing will go up. So it's the same for all of us, for me, or for someone with lung fibrosis. But this can obviously be more of a challenge for you if you have a lung condition, or obviously for a cardiac condition as well. So where you might have more of a sense of actually being short of breath, kind of like a lack of air. So what I want to do and hope is that I can give you just a little bit more knowledge of breathing, which I feel is probably one of the most important kind of tools to help with any sensation or whenever you feel that you are breathless, and to, I suppose, maybe give a little bit more confidence in relation to being active when you have a condition like lung fibrosis. And then I'll also mention also at the end some simple techniques that you could also use. Okay, so first we'll look at breathing and kind of its mechanics. So breathing explained, so simply we'll kind of break it down into four pieces. So you have your inspiration, so that's the taking of the air in. Then expiration is the getting rid of the air, expulsion of the air. Then the gas exchange happens then in between. And then in neuronal control is the nerve or the kind of control of it then. Okay, so we'll look at those all, not in too much detail, but just so we have a good understanding, hopefully. So inspiration then, like I said, is the taking in of the air. So that is basically the active contraction of muscles. So the muscles are working. So your diaphragm and external intercostals, so around your rib cage. So your lung, so as they contract, your lung volume increases. So a change in pressure, so the air will actually be brought in from outside. Okay. Now in exercise, there are also other muscles that can also help with this. They're called the accessory muscles. Then expiration then is, as I said, is the air then leaving the lungs, leaving your body. So it's the relaxation of those muscles that just work to bring the air in. So they just relax, they stop working. So the diaphragm, that big one down beneath the ribs, you see kind of in the picture, relaxes, returning to its what they call resting position, and your intercostals also. So then the lung, so the rib cage and all that, the lung kind of becomes smaller. So this expels or pushes the air out. Then the gas exchange is then the oxygen in the alveolar air sacs moves across these paper thin walls to the blood vessels. And then your carbon dioxide then is transferred from the blood vessels into the air sacs to be breathed out. Okay. Now your control or neuronal control of this is actually not fully understood. Like a lot of things in the human body, they're still trying to understand it more and more. But like, I suppose what it is, well, it seems to be well understood is that it definitely is under our involuntary control and voluntary. So what I mean is that even at the moment, I'm obviously breathing, but I'm not thinking about it and I'm not trying to control it. But I could voluntarily hold my breath. So if I was going to swim, I want to put my head underwater, so I can change it. So the involuntary, I'll talk a little bit kind of more about. So as I said, it's, even though at the moment I'm not thinking about my breathing and I don't have to plan it or anything, but there is lots of different information that's going into my breathing center, which is in my brain, that is affecting my breath at the moment. So even the fact that I'm talking here, which, you know, I don't normally do a lot of kind of giving presentation or talks. So my breathing pattern at the moment, I would feel isn't as comfortable as it would be always. And that's just because information has gone up into my respiratory, kind of the center in my brain, that is telling that I'm maybe not feeling quite as at ease or safe as normal. So that will in turn affect my breathing. Okay. So I suppose that's just a good example. So that it's not a bad thing. I'm aware of it. And then you, as best you can, you kind of try and just relax with it. So this will hopefully make a bit more sense now on the next slide when we go on to talk about exercise. So yeah, so as I said, you have the respiratory control center. It's in the brain, the pons and medulla. So a message relay center. So this is where there's different kind of messages, information coming from your body, your mind included, thoughts and emotions that go up into this center, and that then in turn affects the way your breathing pattern is. Okay. So yeah, this then I have then is just thoughts and emotions. So basically, yeah, as I said, so you'll have your, another good way to put it is you have your parasympathetic nervous system and the sympathetic nervous system. So when the parasympathetic nervous system is kind of more active, or there isn't as much activity with the sympathetic, you'll feel more kind of restful, a sense of ease, decrease rate of breathing, your heart rate. But if there's more information going into your sympathetic nervous system, it's kind of like what you use the term fight or flight. So you'll have an increase in your breathing and in your heart rate, and an increase in anxiety, particularly if this is kind of like an ongoing kind of pattern that you tend to often have a lot of sympathetic nervous system activity. So there's just a lot of that kind of in your body, in your day. So what you'll see is that this is important kind of in relation to our breathing, because we can't change, for example, sometimes things to do with like the lungs and say the lung tissue, but we can, as best possible, I suppose, provide a better environment for us so that we feel kind of more at ease. And then our breathing also can be kind of as best it can be at the given time. So we're hopefully not bringing in too much kind of fearful or stressful emotions, which will just affect our breathing pattern. So shortness of breath then, I was reading like a bit about it. So obviously we kind of know it's where you kind of feel that your breathing is, you don't have enough air. What they do say is that it's, I suppose, with the definition that they often give, that there can be a combination of reasons. So it's, I suppose, a little bit related to what I just spoke about. And that's that it can be that there, because of a lung condition, that there is a lack of air because you've been kind of doing activity and you've been working a little bit harder. But then it can also be because of maybe suddenly kind of feeling quite kind of fearful, kind of not trusting the situation. So this information can then also exacerbate it and lead to kind of feeling quite short of breath. So that's why I suppose in the literature they kind of point out that it's not always just the physical or metabolic reason for the reduction and the feeling of shortness of breath. Okay. So I think I even have this slide repeated because I suppose I feel this is like kind of very important, or the most important really, is that if you're breathless or you feel breathless, if you can just provide then the best environment possible. So remember your respiratory control center, what information it's receiving. So just try as best you can to be, I suppose, accepting and as calm as possible. And this is only in as best you can. So you're just trying as best you can to, I suppose, just be able to sit and be able to observe more and more that your breathing rate has gone up, but hopefully not reacting too much to it. Okay. Then you're also providing a good physical environment so that your physical body is in a good position. So, for example, leaning forward if you feel that's helpful. And then, obviously, if you use oxygen, if you need to increase it, or a fan, some people also like to use those. And then you can also then use your breathing techniques as well. So how breathing can be altered. So we just put this in, but you're probably very aware of that in pulmonary fibrosis, the buildup of scar tissue in the lungs, affecting gas exchange due to less elasticity of the lung tissue. So which then can lead to shortness of breath and obviously fear and anxiety, particularly related to movement. Then in general, breathing also can be affected. So this can be for all of us because of a dysfunctional pattern, just the way we've developed. The way we breathe, and that can be related to like a traumatic event they feel now. Again, there's a lot of research into this. They don't fully understand why some people have a dysfunctional or just not the best way of breathing. And then if you're in a period of stress, whether it's a short one or ongoing, this can affect the way you breathe, your physical posture, so the way you hold yourself, then chest wall changes. So that's the actual kind of like rib cage and muscle strength, and then the physical environment. So this can be just if it's probably doesn't relate to us in Ireland too much, but if it's quite humid, sometimes people can find their breathing is affected. Okay, so then which breathing technique? Now today I'm really going to focus on just some breathing techniques more to do with breathlessness, kind of shortness of breath, like there are ones for chest clearance as well. I will mention positions of ease as well. And then a teeny bit just at the end about just kind of mindfulness or meditation. So the first what I'm putting is just about being present and grounded. So I feel this is very important, and it's what I do at the beginning of all the ILFA classes. So this is for me, and it's also like I hope for everyone in the class, is where as best possible we become kind of just more present with our physical body. So just feeling it. And then as we're feeling your physical body, you can then kind of start to feel and interact with your breathing, and then be just more aware of your thoughts. You don't need to stop them, but then just maybe when you have a bit more kind of, a bit more stillness, then this can just help the physical body and the breathing just to become a little bit more kind of at ease. So that's where you have more information going into your parasympathetic nervous system. So that brings the body, the heart rate and breathing kind of more down. Now, obviously with the exercise, your heart rate goes up, which is good, but you're not hopefully you're quite at ease with all of it, and you're hopefully enjoying it. Okay, so that's why I feel being present and grounded is important in general, and that's why I bring it into our class. So I would feel it's also important then in relation to just your daily life. So when you're doing maybe exercise at other times, going for a walk or any other form of activity like being in nature, just trying to be present and enjoying it when you're with your family and friends. Okay. Then this one then is about diaphragmatic breathing. So I'll kind of just read this. So it also can be described as breathing control. So people use both terms. So it's used often in yoga meditation practice. The diaphragm is used predominantly. So it's, the big breathing muscle. And as this breathing becomes slow and relaxed, it's very efficient and uses less energy than using accessory muscles. So there are muscles kind of more up around your neck and the top of your chest. So it's said that it's better or good practice, good to practice when you're feeling kind of good and relaxed and your breathing is at ease. So you will feel and learn more about your breath and experience how using it can change and how you feel and how you can work with it. More difficult if you try when you're breathless or anxious. So the benefits include increased awareness of your breathing pattern and help develop and maintain flexibility of the chest wall, and also strengthen your respiratory muscles, and then stress reduction. Okay, so I suppose this one wouldn't be related specifically to if you were breathless, but it's very good practice can be very good practice to do, just to kind of help with your breathing pattern, to help use your respiratory muscles in a good way. Maybe also if you have a breathing pattern that's maybe not as efficient, that you tend to breathe kind of higher up in your chest, it can start to change that a little bit. So you're going to start developing kind of a more healthy way of breathing. So I'm just keeping an eye on time here, but yeah, we're okay. So the technique, it's kind of like what we do at the start of the class, but basically the only difference is that with the breathing control or diaphragmatic breathing, they technically not recommend, or but what way to do it is that you breathe out actually through your mouth. So like you're kind of like a sigh or breathing out through your mouth. So what they say is in this position, or in this breathing, you position yourself as relaxed as possible. Allow your body to relax and be at ease. So this would particularly your arms, shoulders, neck. So because ideally you don't want to be using this area, which is kind of more the accessory muscles to breathe. Then you put one hand on your abdomen, so your belly, and then the other one you could put on your chest. Now you don't have to, some people like to put just both hands on their abdomen. Then closing your eyes can help because you just don't have as much information coming in from the external world, which kind of gets your mind going. Then you slowly breathe in through your nose, following the breath gently, allowing it to expand. So you'll feel your belly then rise up. Then you breathe out through your mouth, either like a sigh or through pursed lips, either if you want. Allow and follow it. So you're feeling kind of like a sense of letting go and relaxation with the breath out. So yeah, it's very relaxing to do. So it is similar to what we do at the start, but I don't bring emphasis onto the sigh out, just with what we do at the start of the class. So what we're doing at the start of class will be a bit more what we call a relaxed abdominal breathing. So this is basically can be a follow-on then from your diaphragmatic, but you can breathe out here through your nose, so you don't have to breathe out specifically through your mouth. Then deep breathing. So again, you would probably be familiar with this. So this is where, and it's normally recommended that you do some either what we just were talking about there, your diaphragmatic or kind of relaxed abdominal breathing first, so that you're nice and kind of comfortable feeling your breath. And then you can consciously then take a deep breath in. And you could do maybe 2 or 3 of these in a row. Okay, so then in relation to then, if you're feeling, say, breathless, or your work of breathing has gone up and you want to be in a position that's kind of quite good physically for you to breathe in. So again, you're trying to provide that good kind of physical environment. So the first one on the picture is someone lying on their side. So this again, you're trying to give your abdomen space so it can move out. Then the same, well, it's not the same, but it's kind of, I suppose, a similar reasoning for it will be 2 and 3, you're leaning forward. Well, actually, 2 and 3 are a bit different. They're also providing a kind of a splint for the arms. So you're actually, the muscles around your kind of neck area here can actually help with your breathing. So this could be if your breathing rate had gone up a bit and you're feeling under pressure. Then 4 is just nice upright sitting. So your belly has plenty of space to come out. 5, forward lean, and 6 are often helpful as well. And that again, they can be helpful because you're also providing a splint for the arms, so the accessory muscles can work. So again, if you're under a little bit more pressure. And then 7, just leaning up against something. Okay, then pursed lip breathing is a technique where you inhale through your nose and exhale through the mouth with a pursed lip. So like some people say, like you're blowing out a candle. So it can help when you're breathless. That's primarily why you would do it. They feel it can slow your breathing rate, and it can also expel the amount or increase the amount of air that you kind of get out, because you're kind of prolonging the breath out basically by pursing your lips. So that's where it can be beneficial. Okay, so the technique, so a comfortable position again, so just where you physically feel comfortable, breathe in through your nose, hand on your belly again. As you breathe out, let air out through a small hole in your lips. Then they say stop when you feel a contraction or activity in your tummy muscles. That's kind of, when the breath out is complete. So a lot of the literature or recommendations would be to kind of do it maybe 3 to 5 times, then take a break from pursed lip breathing. But if you wish, go back to it. It's just that sometimes breathing this way can actually increase kind of what they call the energy used for breathing. So it's often not recommended to continue doing it for too long. Okay, then blow as you go is mentioned in some information kind of guidance for lung fibrosis. And it said the technique can make tasks easier, and you can also use with pursed lips if you want. So what you're doing is you breathe in before you make an effort, breathe out while making the effort. Okay, so it can be something you might do naturally yourself anyway. So it could be like you breathe in before you go to lift something, and then you breathe out while you're lifting it, or going up a stairs as well. Some people would use techniques like this. Then pace breathing they say is helpful when doing more so activities like walking. So you're pacing your steps to the breathing. You can use it with pursed lip breathing and blow as you go. So in this technique, your counting is recommended to help set your pace. So obviously this depends on how you are in your own breathing pattern. So normally if someone's going to do it, now you may be naturally develop it yourself, or it could be one that if it's going to be beneficial for you to work with or do it with one-on-one with a respiratory physiotherapist, like say in your local hospital, or perhaps even with a respiratory nurse as well. So it can be used, for example, with stair climbing as well. Or I do know, for example, that when people do hiking, like climbing up high altitude, And obviously there's a big increased work of breathing when you do something like that because you have a lack of oxygen in the air. So I think often in this kind of technique is used where people will kind of count when they're doing their kind of steps as well. Okay, and then we're nearly done. So guided meditation / meditation practice. So this will be similar to what I do at the beginning and at the end of the class. And it can allow basically your thoughts and emotions to become more calm and at ease, or basically you're not as attached to them. So you've hopefully a bit more awareness of your thinking pattern and your emotions. And because possibly then as you have more awareness of them, you're not as drawn into them then. So yeah, you'll just be a little bit more at ease, possibly feel a little bit more in control in general. And then this can then have a positive effect on your breathing. It'll have a positive effect, hopefully, just in general, but just when we're talking about breathing, it can have a very good effect on your breathing pattern, becoming more aware of it. Then what to say? Oh yeah, sometimes after using guided meditation visualization, then you can focus on your breathing pattern. So it can be a nice, to do that kind of practice where you become kind of calm and at ease, and then start working and just enjoying maybe doing the diaphragmatic breathing and then doing a few of the larger breaths in as well. Right. So yeah, this is a repetition of what we said earlier, but I feel very important. So if you're breathless, provide the best environment possible. Okay, and that's just at a given time. So you're not putting yourself under pressure, but you're just trying to be as you can, as accepting and calm. So some people describe it as that you're like the parent watching the person who's breathless, and you're trying to be very helpful and calm, and you're not putting yourself under pressure. Then also just putting your body into a good position, also just to help the breathing. Then if there's any techniques that you find that are helpful, you can then start to do those also. Okay, so then if we have any questions, so I'll just come out of this.
Thanks for that,
Stop. Oh, you're welcome. Thank you. I think I'm trying to...
You're good to go. That was incredibly helpful, really insightful, very comprehensive. At the moment, we don't have any questions that have come in yet, so I'll just remind the group here, we've got a little time.
Okay.
If you would like to submit a question, you just click on that little Q&A button, type in a question, and then we'll address it. While we're waiting, there were a few questions that occurred to me as you were talking, Eimear. You described kind of early on, you had talked about that sort of vicious cycle that occurs where people are afraid to exercise and therefore they avoid it. Can you kind of walk through the rest of those steps of that exercise cycle, and then how, or that avoidance cycle, and then how exercise kind of turns that back around again?
Yeah, so like I feel like, well, from experience working with people, and it's obviously mentioned a lot, like in literature, that when we have experience at times in our life of being kind of like short of breath. So that's different to like me going for a run and my breathing coming up. Like I'm not worried about that. That's fine. But for example, if you have an experience of whether you're active or not, but a period where you feel you actually don't have enough air and you feel it's extremely fearful. And if that then is related to, or particularly if you know that has happened when you do movement, like your brain will kind of tell, well, I think I probably shouldn't be moving a huge amount because it's the last time I did it was horrible. So like it's kind of logical what your mind will tell you, but at the same time it's not good to do that. So I suppose that's why I was hoping that like the more people can understand and realize that, yeah, maybe at that time it could have been to do with the movement, maybe it wasn't totally to do with it. It was to do with the movement, and then possibly the reaction to your breathing rate going up and feeling fearful as well. So I think it's just to kind of know and understand that being kind of breathless, and particularly a sensation of shortness of breath, to try not allow it to kind of link it too much to movement and that you shouldn't move. So just maybe to get, if it has been an experience, to get back to doing some form of physical activity or formal exercise, but at a very like low, not, I don't mean low level, but at a level that you feel comfortable at. So be very gentle with yourself, and then kind of like I said, like being the parent to yourself, and then gently starting to increase your activity if you can, but in a nice kind of controlled way, and possibly with a group or with someone, maybe with the guidance of a professional as well who can explain that a little bit, can be good too.
Okay, that's really helpful. Thank you, Eimear. So we're starting to have some questions coming in, which is great.
Okay.
Jim is asking, when using O2 with a conserver, I breathe through the nose. Can I breathe through the mouth and only through the nose when I feel I need a pulse of O2?
Can I breathe through the nose?
You were talking about some of the breathing techniques where you're breathing in through the nose and out through the mouth.
Yeah. So if you use the one that's stimulated just by your nose, so his breath is his oxygen is given when he takes the breath in through his nose, isn't it? So what he's saying? Yeah. So primarily when you are taking a breath in, if you take a breath in through your mouth, I'm not saying it's wrong, but ideally it should be through your nose. So for any of the techniques I actually was talking about, the breath in, so your inspiration will come in through your nose. So it's more the breath out can be sometimes primarily through your nose, or you can be encouraging it to come out through your mouth with kind of pursed lips. But ideally, your breath in should be coming in through your nose anyway.
Okay, great. Now there's a very technically question here that I'm not sure if you can answer this, but is it safe to exercise with a desaturation level of 70?
Ooh. So basically, the answer would be no, really. So if you're, no. So when I was working in the hospital, if someone saturations were, particularly we're monitoring them because we knew they had like a respiratory condition, for example, if there were 70, we would definitely stop you. You would have to. So yeah, no, I can't say how that would be. Yeah. So I think, and I probably, if your saturations are going to that level, I would exercise, whether it's with an ILFA class or say your own walks, I would probably be linking in with, well, like definitely your GP, but even respiratory team, just to see, just in relation to like your for example, your oxygen and whether you need more, or like they may want to do an ABG as well, like because the oxygen saturations that they take aren't as accurate. Like they're a good guide, but they're not extremely accurate, So yeah, but no, I couldn't recommend really exercise at that level.
Okay. And kind of similar to that, as the disease progresses and you're getting advanced pulmonary fibrosis, what should you do as that's occurring?
Yeah, so as this disease is more advanced, and say you're on higher levels of oxygen, and maybe your ability, like say your physical ability is much lower, I suppose I would feel a physical activity. Now it just depends, because it's easier if I could speak, obviously one-on-one with someone, but that you should be trying to be active if you can. But this is just, again, just for your overall well-being, but also depending on your situation. Now I don't know, but say if you were for a transplant, so even if you're at the more progressed stage, you want to just be as good as you can be if you're, for example, going to have a transplant. Or if not, I think still being active, I suppose, is just good. But you just only can do as much as that you can. So again, I suppose what I said on the slide, I know it's simple, but what I feel is that most important is that you just try and be as calm as you can be, but obviously not putting yourself in a situation where your breathing is being put under a huge amount of pressure. So again, using the techniques, I didn't really talk about that. It's, I suppose, more occupational therapy, but pacing. So if you're doing activities, even if it's getting up in the morning, to do it very slowly, and get up, sit on the edge of the bed, work with your breathing a little bit, then perhaps put on your clothes, but maybe not try to do everything in one go. So again, I know it's easy for me to say, but being as grounded and present as you can and just kind of working with your breath, I feel will be helpful.
Okay. And then the last question that we have is, what is the best breathing technique when you're on oxygen? Is there one in particular you'd recommend?
Oh, no, like, oh, so like if you're on oxygen, again, like you'll be, well, you can take oxygen like with a mask. Most people will have it nasally. So ideally you should be, it's better to breathe through your nose anyway. So the fact that you're on oxygen doesn't really change the breathing. I suppose the most beneficial, I think, breathing technique is to be able to breathe well. So the other ones are sometimes more to do with if you're breathless, but I think just being maybe to be a bit more conscious of how we breathe. So there is a lot more known now that a lot of us just don't breathe very efficiently. So we tend to breathe up here a lot apically, and that's whether you have a lung condition or not. So if you can breathe more from your abdomen, so kind of like what, and like I will provide the slides or what I do at the start of all the classes. So if you get more and more comfortable and familiar with that, what you're doing there is hopefully breathing quite efficiently. So you're using your diaphragm, that big muscle, and you're not really using muscles up here much at all. So it's a very efficient way to breathe, and you're hopefully just changing the pattern or habit that you may have developed where you breathe in a different way. So I would feel that's possibly the most important thing people can do.
Okay, that was the last question. However, then another question occurred to me. Is singing exercise?
Yeah. That's, well, actually, yeah, I never even thought of that. So that would be very, like a very good, like, what would you call it? Respiratory muscle. It's what they call, because they even do talk a little bit now about inspiratory muscle training. So remember I was saying with the breathing cycle, the taking of your breath in uses muscles. The breath out is more relaxation of muscles. So it's not technically active, as in it doesn't take energy. But for me to take a breath in, or you or anyone, there is muscles that like contract and work. So when you're singing, as far as I'm aware, you definitely use those inspiratory muscles kind of quite well and in a different way. So yeah, no, definitely.
Great. Lots of options there with our exercise. Now, there was one other question that kind of came in. It was just asking for you to comment on breathing while sleeping. Now, that's going to be something you can't control, is it?
Yeah, like you can't control, like that's definitely your involuntary control. Now it's, do you know what? It's probably a big topic. It wouldn't be one I'd be expert on, but some people definitely have issues to do with their breathing when they're sleeping, like sleep apnea. So I suppose like all I can say is if you feel there's an issue to do with that, you really need to talk to your GP first and then refer to like, respiratory, like sleep technician, where they kind of look at your breathing pattern to see what's happening at nighttime. So some people are stopping and then they're retaining their CO2. So it can really affect your energy levels and just how you feel in general. So it's quite, it is something if you're concerned about. Now reducing weight helps it. That's one thing I do know. But otherwise I would definitely go see someone.
Great. Which exercise helps you reduce weight.
Yeah,
so there you go.
Yeah.
Okay,
Helps everything.
Great. Well, once again, Eimear, thank you so much. Really appreciate it. Excellent, super informative session. And just before we go, everyone, Eimear teaches our exercise classes. They are 3 times a week. If you would like to sign up for our exercise classes, just contact us at info@ilfa.ie and we can get you registered. In addition to that, thanks to some funding from the National Lottery and the lovely folks at the Mater Hospital, ILFA is going to be producing a strength and conditioning video here in another few months' time. So be watching for that. And then last but not least, our next session is going to be with Helen Mulryan on the patient charter and entitlements. And that is going to be on the 15th of October at 11:30 a.m. So please come back and join us for that. Once again, Eimear, thank you so much. I really appreciate it.
You're very welcome. Thank you, Maureen, and thanks everybody for attending also.